Good evening, my doctors. So today in this Monday conceptual class, I am going to summarize few very important points regarding growth hormone. So for every session, we will be discussing one hormone. Today I have taken growth hormone. So as you all know, growth hormone is the most abundant hormone from anterior pituitary gland, and it is also called as somatotropin. So the other name of growth hormone is somatotropin, and it is controlled by hypothalamus. One is growth hormone releasing hormone called as somatokinin, and other is growth hormone inhibitory hormone called as somatostatin. So first of all, we must be clear about these three words. Somatotropin is growth hormone. Somatokinin is growth hormone releasing hormone, and somatostatin is inhibitory hormone. Okay, and it is one of the most important hormone from anterior pituitary. Why? It is most abundant also, and it is secreted in pulsatile fashion. If I want to summarize you the function of growth hormone, try to understand growth hormone actually acts on JAK-STAT pathway. It also activates liver to release somatomedin called as IGF. So whatever actions are done by growth hormone, they are called as direct action. And whatever actions are done by IGF, they are called as indirect action. So there are direct action, there are indirect action. Most of the actions are same. Okay, like two of the action of growth hormone and IGF, they are similar, like protein synthesis and bone modeling. So bone, I mean epiphyseal growth and protein synthesis, these two functions are common, I mean same for both growth hormone as well as IGF. I hope you will not forget that. So two of the actions are same, similar in the growth hormone as well as IGF. Rest two action are opposite. Growth hormone is the lipolytic hormone. Remember that. That is why a lot of people are taking growth hormone injection because it is dissolving the fat, although increasing the protein synthesis. So muscles will be, more, but it is lipolytic hormone. On the other hand, IGF is anti-lipolytic. Okay. So regarding epiphyseal synthesis and the protein synthesis, both are same, growth hormone and IGF. But regarding lipolysis, growth hormone is doing lipolysis, but IGF is anti-lipolytic hormone. One difference. Second difference is that growth hormone decreases sensitivity of the insulin. So that is diabetogenic hormone. That is why whenever there is more growth hormone, it causes pituitary diabetes. You know that. On other hand, IGF is increasing the sensitivity of insulin. It behave like insulin. This is clear. So remember, growth hormone is the master hormone, and IGF is the servant. Okay. So the action which are done by the master, the king, they are called as direct action. And those actions which are done by the servant, they will be called as indirect action. And JAK-STAT pathway is for growth hormone, but tyrosine kinase pathway is for IGF. Because almost all the growth factors are acting on tyrosine kinase pathway. So although both are acting similarly, but growth hormone act on JAK-STAT pathway, and IGF acts on tyrosine kinase pathway. So these are the few important differences in the function of growth hormone and IGF. Now, if growth hormone synthesis is less, it can cause dwarfism. But sometimes growth hormone is normal, but because receptors are mutated, so person will be dwarf. So what is that called as? That is called as Laron dwarfism. So Laron dwarfism is the clinical condition when growth hormone is normal, but receptor is mutated. And the third clinical condition is African pygmies. What is African pygmies? There's a tribe in Africa where growth hormone is normal, but IGF after the puberty they will not rise, and that is why they will look like dwarf, and it is called as pygmies. Is this clear? So let me summarize quickly. Number one, growth hormone is released from anterior pituitary gland. It is the most abundant hormone. It is also called as somatotropin. It is controlled by somatokinin and somatostatin. T half is very, very less. it is secreted in pulsatile manner. Okay, it also activates liver to release IGF. Those actions which are done by growth hormone are called as direct action, and those actions which are done by IGF are called as indirect action. Two of the action are similar: protein synthesis and epiphyseal growth. So both have same action. Two actions are opposite. Growth hormone is lipolytic hormone and it decreases sensitivity of insulin. But IGF, okay, IGF is anti-lipolytic hormone and it sensitizes the insulin. If growth hormone is normal, okay, and even then patient is off, it can be because of mutation of the receptor and it is called as Laron-Dofism. Now, sometimes they ask you, if you give injection of growth hormone, what happens? So if growth hormone increases before the puberty, it causes gigantism because height will increase. But if you are giving growth hormone injection after the puberty, after the closure of epiphysis, then it can cause acromegaly. It can cause acromegaly. So I hope this is clear. So there are 15 important points regarding growth hormone. I hope you will not forget this. So again, I'm telling you every Monday and Friday I will be coming here for a very ultra short session, not taking much of your time. It should be entertaining also. And of course, I hope you are getting some important points. So that's it. Thank you. Good night.